Hi, shalom, and welcome to my channel. My name is Tamar. I'm a wife and mother living in Israel, and I just gave birth to my fourth baby in Israel. In this video, I wanted to talk about the key differences between giving birth in Israel, which I've done 4 times, versus giving birth in the USA. My sister-in-law gave birth in both the US and in Israel, and she helped me come up with these pointers. The first one is the cost. Giving birth in Israel is completely free. We have a universal health care, and it's funded by a national insurance scheme. The national insurance pays the hospital 15,000 shekels for each woman giving birth in that hospital, which makes it kind of a competition. All the hospitals are trying to get more women to give birth in the hospital. Prenatal is also almost completely covered, very, very minimal costs. There are private doctors, or you could go to a private procedure, but very, very few people do that here. So when you think about any economic strain because of prenatal, pregnancy, or giving birth, this doesn't even cross your mind. You know that you're completely covered. Any procedure that you need will be paid for. Even fertility treatments in Israel are almost completely free. And this sounds amazing, and as a consumer, this is really amazing, but there are downsides. One is that it comes at the expense of the doctors, who are probably overworked and underpaid. And in the US, it really depends on your private health insurance that you have. But even with insurance, hospital and bills are very, very expensive, and you still may have to pay, large sum like co-payments, a certain percentage of the total, or some deductible, so it could still come out to quite a lot. For example, let's say your hospital bill for giving birth was $15,000, you might still have to pay $4,000, so it still can be a very expensive thing. Also, your insurance might have uncovered services. For example, if you need an extra procedure or your baby needs some extra procedure in the hospital, these could come out to a lot of money. So those of you from the US, what was it like for you in terms of the payment? Was it something you thought about? Was it something you had to think about during the pregnancy? Did it come out to a large bill? I'd love to hear in the comments below. In the US, the doctor that you see for your prenatal visits is also the doctor that you meet in the hospital, or at least someone from that practice. They have an on-call system. When you're in labor, you call your doctor, and him or someone from his practice come and meet you at the hospital. In Israel, the person who's involved in your prenatal and the people, the midwives and the doctors that are involved in your birth are not the same people. There is no connection between them. At week 37, 38, my OBGYN said to me, okay, good luck with the birth, and I'll see you here 6 weeks after the birth. She has nothing to do with the actual birth, which leads to our next point, that in the US, you can only go to the hospital that your doctor and his practice are affiliated with, and you can only go to the hospital that your insurance allows for. Where in Israel, you could go to any hospital that you want. In Israel, there are about 20 hospitals that you can choose to give birth in. You can go to any one that you want. You'll probably go to the one that's closest to your home, like I did, or if there's a hospital that you like their approach, if they have more water births or something that they're known for. And if you're curious to see my experience in the postpartum ward in my hospital, you can check this video out. Because in Israel you can choose to go to any hospital, this means that every citizen in Israel, rich, poor, it gets the same care and is entitled and eligible for the same care. Where in the US, it depends on your health insurance. The better insurances allow for better doctors, and the top-notch doctors only work with certain insurances, and this means that you're not really getting the same care, and it depends on what your insurance policy is. Doctors versus midwives. In the US, the birth is attended by doctors. Now, they might not be there for the whole time, but for the actual delivery, you must have a doctor present. Where in Israel, the people that run the show and who have to be there during the delivery are midwives. The doctors are there, they're on call in case they're needed. For example, if the placenta remains and you need an obstetrician to remove it after the birth, things like that, you have a doctor on call. But the actual people running the show are midwives, who are nurses who specialize in labor and delivery. And I understand that the US also have some midwife-led centers, but that is not the rule. In Israel, that is the complete norm. The most important statistic in birth in general is the mortality rate. of both the maternal and the baby. Now, Israel, compared to other Western countries, has a very, very good rating, whereas the US has unusually low ratings. 23 maternal mortality rates per 100,000 live births, and also a high infant mortality rate of about 5. Why is this the case in the US? I read a few reasons. Perhaps not everyone is entitled to such good prenatal care, and also there might be underlying health issues, there might be gaps in the society. So there's a lot of different reasons why this is the case, but US does have unusually not the best numbers, and Israel actually has one of the better numbers in compared to other Western countries. The birth rate in Israel is high. This is true compared to other Western countries and compared to the US. In 2023, there were about 21 births per 1,000 people in Israel, and in the US it was about 12 births per 1,000 people. This means that in Israel, at any given moment, more people are giving birth, which means that doctors are gaining more experience. Also, because everyone in Israel is entitled to health care, so this means that doctors are seeing a wide range of different situations that arise from all ends of the population. So they have a wide variety of scenarios and also a heavy workload, which also contributes to their experience level. But the US does have a lot more population, which means also there, especially in urban cities, doctors are gaining a lot of experience. The last one is that in the US, in particular the New York, New Jersey area, medical staff are very legally conscious. They have a fear of being sued, and this is why the US, in comparison, has more interventions during birth. And Israel is also, I understand, is becoming more legally conscious and perhaps catching up with that, but much less so. And one indication for this is C-section rates, where in the US, C-section rate is about 30%, and in Israel, 20%. Now, this could also be for cultural reasons. People could ask for C-sections. It could be for many different reasons. I was interested and tried to see about the use of epidural, but it's very hard to find information, especially in Israel. This medical information is not public information, but I saw somewhere that in the US it's closer to 60% of women use epidurals in vaginal deliveries, and in Israel it's closer to 50%. But this could mean a lot of different things. It could be cultural. There weren't enough anesthesiologists, so this could actually mean that there wasn't the medical care, and less that more women opted to go natural. So it's pretty problematic data. So those are the main differences between giving birth in Israel and giving birth in America. Hope you enjoyed this video, and I'd love to hear if you have any comments or questions down below. Shalom, and I'll see you in the next video.